Hi, I am Dr.YVRao, plastic surgeon from Dr.YVRao Clinics, Hyderabad and Vizag. Today we'll be operating on a case of 70-year-old, 65-year-old lady with sagging eyebrows and significant facial aging also. So I have done facelift for her, and then now I'll be operating on the eyebrows, that is upper part of the upper third of the face, by subcutaneous gliding eyebrow lift. So we'll be showing the markings also in a few seconds. So these are the markings I have done, and this is the extent of the incision, that is from the midline, mid-pupillary line to the lateral eyebrow region. So approximately 2 inches in size, which is along the hairline, whereas the rest of it is all. So I'll cut it here and then put my finger or some instrument and then elevate the skin from the underlying structures, the muscle, and then up to this part, including the eyebrow also, up to this part. So, and then lifting the entire thing and then fixing. Why it's called gliding is the skin glides over the beneath the structures, and then we fix it with the transfixation sutures like this. This is giving nowadays excellent results, and then this has become popular recently and for the past 5 years, and the relatively simpler compared to rest of the very invasive procedures like subperiosteal lift or endoscopic lifts. This is a relatively simple yet giving the good results, and we can even go up to this region and then elevate this entire skin also. So that means we can even make this crow's feet also disappear.